I'm Milind P Sovani. I'm Assistant Professor and Consultant in Respiratory Medicine at Nottingham University Hospitals, United Kingdom. The interesting thing is there are very limited original data from India in terms of large scale population studies. What large scale data we do have come from smart wear devices. So, one of those large data includes some data from Fitbit, where India was shown to be at the almost at the bottom of all the nations with 6.5 hours of sleep, where this was along with Japan and Singapore, whereas New Zealand and UK were at the top with sort of 7.5 hours sleep. However, that needs to be taken with a pinch of salt because not all Indians have these devices, and we don't know how those who don't have these devices sleep. Maybe they sleep longer. The data to summarize, the data we have suggests we are losing out on sleep, but we ideally need much larger studies to confirm that is the case. That is, so in India, road traffic accident is a major problem. We get around 500,000 road traffic accidents. These are serious road traffic accidents, not little sort of bumps that nobody sort of reports. And there has been a year on year increase from 2002 right up to now, with deaths due to road traffic accidents going up from 100,000 to almost 150,000, and this is clearly a silent killer. Of course, in India there are going to be number of reasons. So we will have poor infrastructure, poor lighting, issues with road maintenance and vehicle maintenance and so on. But it's possible that at least a proportion of these incidents and accidents are likely to be because the driver falling asleep at the wheel. Usually between 10 to 30% of accidents, depending on where you look in the world, are identified where sleep is the sole cause or has contributed. Now there are very limited, if any, Indian data with regards to this, and again I think the first thing will have to be that we look at a large scale study looking at actually investigating these crashes in terms of to try and identify and establish cause for these crashes. That will give us some handle in terms of to what extent sleep deprivation is partially or totally causative in road traffic accidents. All over the world, as you know, there has been an epidemic of smart screen use. So this could be a mobile phone, this could be a computer, portable computer, smart tablet and so on. There are good data mainly from the European and American data that the more number of devices you use, the more number of hours of sleep you lose. So starting from hardly any loss of sleep with minimal device use at night to sleeping only 5 hours a night with 2 to 3 device uses. Again, a major, at least the urban and the suburban populations in India, and including young kids, now have access to these devices, and they are very likely to have very similar effects. The other issue with these devices is the exposure to blue light. Blue light is part of the visible spectrum of light, which is high in energy, and what this does is that when we are exposed to blue light, particularly in the evening, it suppresses melatonin production. That in turn will lead to delay in sleep. I think going back to the theme around the accidents, really, when we look at other major economies around the world, there are frameworks in terms of investigating these accidents, identifying the cause, and more importantly, there are regulations in place and guidelines in place for employers who employ drivers and for physicians who look after these in terms of how to investigate these individuals, how to treat them, how to ensure that their sleepiness is treated and corrected and they are safe to go back to driving. I am not aware that such a framework exists in India, and I think it would be a really good first step if we just start looking at the data and then starting to, after data collection, looking at some guidelines for clinicians and the employers.